Hello and welcome to our presentation today. Today we have Brenda Newton Fox. She is our Associate Clinical Social Worker, and her journey started with community hospice in 2015. She's been touching lives and providing support to our terminally ill patients and their families, and she currently works at our Hope Chest Counseling Department, and she meets the needs of our families, our mental health and behavioral patients with behavioral issues. And she has really enjoyed a rewarding career in the field of substance abuse and mental health for over 25 years of as a program manager, providing services in multiple capacities up until her retirement in 2013, at which point, she made some changes in her life, and she came and joined with us. And she obtained her graduate degree in social work from California State University, Stanislaus, and she is a certified alcohol and drug counselor. Her great passion is to bring healing to people who have been through a really traumatic and stressful experience. She has been a huge asset for us, and we're so excited to introduce her today and let her do her presentation. Brenda, I'm going to let you take it over. If you guys have any questions, concerns, please feel free to put them in the chat. If you feel that you have a question and you're not sure how to use the chat, please feel free to just interrupt. We're good at interrupting and being interactive here. So is that okay, Brenda?
Yes, ma'am.
All right, my darling, this is all yours. Thank you so much.
Okay, thank you, Karen, for that warm welcome and that warm introduction. So once again, welcome to the Understanding and Identifying Grief presentation. So I want to begin by just giving you kind of the purpose of the presentation, some of the goals that we want to be, the objectives we want to be able to gain. So we want to be able to provide a definition of grief, describe the types of grief, describe their symptoms and the stages of grief, and also to provide tips on how to cope with grief. So, grief is the normal reaction to loss. It's the emotional suffering one feels that comes from losing someone or something that is important to you. It's a natural part of life. It is a typical emotional, physical, and spiritual reaction to death, divorce, job loss, or any major life transition. To know grief, to examine it, is to know a multitude of things. Multiple things are indeed true when it comes to grief. So grief is sadness, grief is unbridled rage, disbelief, and the inability to accept a loss that has shattered and forever altered our lives. So grief is all these things and none of these things at the same time. That is because grief is an individualized experience. It doesn't look one specific way, and it doesn't feel the same for everyone. And how you hold that grief and how it manifests for you personally is varied as well. So I want to talk about the different types of griefs. There is normal grief, and this is grief that usually lasts about 6 months to 2 years. And with all of these types of grief, there comes signs and there's symptoms, and we'll talk about that later. So there's anticipatory grief. And this is an emotional response that happens ahead of a loss. Anticipatory griefs, it helps you to process the grief before it happens. So some of the examples are that, you have your loved one, and then your loved one gets diagnosed with a terminal illness. We as caregivers, loved ones, were there at home, and or the individual may be in a facility or somewhere, but as their caregivers, we are there providing that care to them. And so, which means that oftentimes it can become so overwhelming because we're, our lives, we engulfed in caring for that individual while they're with us. So at this time, when that person first becomes diagnosed, there is anticipatory grief that sets in because we know that there will eventually be a loss. And so this is a good time that while you're caring for your loved one, to also is to get in touch and to seek some counseling, talk with somebody so that you can get in touch with those feelings while you're doing the caregiving. We also have that complicated grief. And this is a type of grief that can be very painful emotions, that one gets that lasts for so long, and it can be very severe. You have trouble recovering from the loss and resuming your life. So, this is the kind of grief that I like to say that you become stuck. And I'll talk about that grief later on because that is called complicated grief. And so we prolong. And so we'll talk about that a little in the next couple of slides. And then there is, the disenfranchised grief. So this is grief that society doesn't fully acknowledge. This is that type of grief that one feels or is unable to feel due to, for example, hidden relationships, that have not been acknowledged, but that loved one passes on. A person who dies from a drug overdose, you know what I mean? Society says that, it's not recognized that, because it's something that the person, imposes on themselves. So it's not validated by society. There's the loss of abusive partners and pets. So these are not recognized as being significant. So it's when you're grieving that you're feeling, when it doesn't fit in with what the larger society attitude about dealing with death and dying. So when this type of grief is not recognized as being valid by others, people, you may start to question their own feelings and get a sense of feeling anger, shame, or guilt for you experiencing the type of grief, which can prolong it. And then there's traumatic grief. And this is losses that's due to suicide, homicide, accidents that are sudden. So this type of grief can also include symptoms of PTSD, where fear sets in, where powerless sets in, whether it's witnessed or unwitnessed, the different traumatic incidences that happen. There's a sense of being powerless. And so there's some common signs of grief that I kind of want to touch on. So when you're going through and you've lost a loved one, there's physical effects. And, there's signs of being exhausted, fatigue, there's a loss, and sometimes there's an increase of appetite. You don't want to eat and or you're so nervous that you increase your eating and also as well as sleeping. There's sleeping problems, you get headaches. So those are some of those physical effects, symptoms from grief. Then there's the emotional and or psychological effects, which means that, there's denial, there's that anger, there's that guilt that you get, the sadness, and of course, there's those mood swings where, some days you're happy and then other days you can be very, very angry. You're up and down, sort of like a roller coaster. And then there's those social effects. And from those social effects, it means prolonged withdrawals from normal activities. You don't get any pleasure. You don't want to do any of those activities that you used to do, which sets up isolation, where you kind of just enclose yourself and feel shut off from others, don't want to come out and don't want to engage. So I like to kind of talk about the different stages of grief that we go through. So Elizabeth Kubler-Ross, she proposed that there are 5 stages of grief in her book on the death and dying. And so these include that when you lose a loved one, the first stage that a person go through is denial. Now, I want to keep in mind that these are stages, the 5 stages of grief, but you do not have to go through these stages linear. It's individualized, and you go through these stages of where you're at. So there's no linear way to go through them, and there's no set length of time when to go through or how you come out of these stages. It all depends on you as being an individual. So that denial and that shock and disbelief, that's the first stage that sets in. This is where we refuse to believe what is happening. You get this feeling of numbness, that which is a normal reaction because it protects you from getting those intensity of the loss. There's that, for an example, when they tell you that, there's your loved one has just passed, you go into this shock, you feel numb, there's a disbelief, and you kind of start where, no, it didn't happen, or I don't believe this. And then that next stage that we go through is the anger stage. This is a stage where there's a feelings of powerless, which can lead to the anger from loved ones. You can get so mad that you can get angry at yourself. You start blaming others for your loss. Some people even blame a higher power, whoever they call their higher power, could be God or just whoever, or you can just get angry even in life in general. So there's this anger that sets in. So some examples is, if your loved one was in the hospital and the doctor comes out and the doctor tells you your loved one has just passed, anger can set in, and then you can start blaming, Well, if they had I'm angry at the doctor that they could have done more, or why didn't they try this treatment? So that anger sets in. Then that next stage is bargaining. So bargaining is where you can start being, you can bargain with God, you can bargain with your higher power, you try to make deals, to have your loved one back as they were before the tragic event occurred. It's easy to become preoccupied by what you could have done differently. So if there's things that could have been done differently, you can be so preoccupied in that until you can start bargaining, wishing that relationship was back as it was. Then there's depression. So when the extent of the loss sets in, many people experience symptoms of the depression, which is a very likely outcome for all people that grieve loss. So, there's sleep difficulties, appetite disturbances, you have lack of energy, you have these crying spells, there's times where you just want to close off, you want to, not come out the home, you don't want to be bothered, you go into a deep depression. So this is the most difficult stage to deal with, because oftentimes there is thoughts of suicide. And so I always encourage when you have those thoughts of suicides to please seek help. Make sure that you can talk with someone about what you're feeling and what you're thinking. Then there's this stage of acceptance. So acceptance that's the final stage of grief. This is the stage where you can kind of come to terms with all of your feelings, and you're able to accept the loss. You're able to regain some of your energy, and you start seeking goals for the future. This stage also represents the beginning of the healing process. It may take some time to get to this stage, but you will get there. And sometimes when you go through that grieving process, or when you have just been told that, there's a loved one who has passed away, and even though it's normal to feel those signs or symptoms of sadness and grief, many people, they start to experience this intense and persistent yearning, this longing, as well as you get other negative emotions as well, that fear, that sadness, the guilt, the anger, all of these symptoms set in. But when these symptoms become or continue to be very intense, more than 12 months after the loss, this may be a sign that the person, you could be experiencing what is called prolonged grief. And in that, there is intense sorrow and rumination, just fixation on that person, inability to focus on anything else. You're just so consumed. Extreme focus on reminders of the loss. You just revisit it, longing for the loved one. There's feelings of numbness, you get bitterness, and there's a sense of purposelessness. You have a lack of trust. And then there's also a feeling of a loss of pleasurable. Things that were pleasurable to you, you no longer have that feeling, those activities. You no longer gain any pleasure from them. So people with prolonged grief are basically stuck. They're stuck in this state of chronic grieving. You grieve, and there's normal grieving, but when it gets to the extent to where it's just so fixation, and so where you're starting to kind of feel like, there's those suicidal tendencies, this is when you need to really seek some assistance, some help. We have a lot of evidence based on, a lot of the evidence out there that suggests that prolonged grief is it's a mental health condition. It's classified as another form of depression and anxiety. So how do we cope with our grief, and how do we cope with our loss? You find support after you have a loss. You turn to friends, turn to family members, draw comfort from your faith, a higher power, Join the support group, so I know often it takes a while to want to join those support groups, but there's support groups out there where you don't have to feel alone. There's support groups where there's people that have a common bond. And, sometimes you can just go, we can sit, and we can just hear how other people have coped with their loss, so that we know that we're not alone. You can talk to a therapist, or there's grief counselors. But above all, take care of yourself. Face your feelings. Express your feelings in a tangible or creative way, oftentimes journaling, through music, things that, if you're unable to express yourself, you could express it in other ways if you can't do it verbally. Look after your physical health, make sure that you're eating healthy and, getting the proper rest and exercise. And above all, don't let anyone tell you how to feel. And don't tell yourself how to feel either. Feelings are feelings. Feelings are normal. And so however you're feeling, embrace and feel whatever the feelings are. And you also want to plan ahead for grief triggers. There's things that can just trigger you. Oftentimes, the smell of someone's clothing can trigger you. Special places that you went with that person can be triggers. So plan ahead that if you know I'm going out here to eat, this is our favorite restaurant, plan ahead for it, kind of so that you know when you get there, if there is triggers, that you have some type of coping mechanism in place that can be able to help you to embrace it and work through it. So with community hospice, we do have some grief support services. We have our children's support group. We have our children's bereavement. We have our Hope Counseling, which offers services to people with family, mental health, and behavioral issues, which are therapeutic services, is also available for children, teens, and adults. And we also have our individual bereavement support. So that's the end of our presentation. And so we'll open it up for any questions.
Brenda, thank you so much. That was absolutely amazing. Some really good information there. Have a couple of things in the chat for you. Rita said right at the very beginning of the presentation that she felt that very first picture was really great and very expressive. And she said she knows exactly that feeling. And her question is, does complex bereavement include feeling guilty and having fun? Feeling guilty for having fun?
Yes, oftentimes, well, not only through the complexes, through the whole. When a loved one passes away, it just, you yourself can feel guilty because there's a part of you that says that my loved one is gone, and I shouldn't feel relief, or I shouldn't go on with my life, and I shouldn't enjoy things that are pleasurable to me. And so sometimes guilt can set in when you find yourself wanting to do outside activities that doesn't include your loved one because they're no longer here. So that guilt can't set up. But you got to keep in mind that we go through that grieving process. And once you go through the grieving process, you want to be able to move on with your life in a healthy way. You want to be able to go out there and get back and start doing some of the activities. You want to live again.
Yeah, Brenda, if I can add to that a little bit,
Yes.
As a hospice nurse, and with all of our team, with the social workers and the chaplain, we really stress to our family members, even before the patient is getting close to the end of life, that we really need to remember the things that we enjoyed in our life, so we know how to fill the hole and the void in our life. And though our loved one has passed and is going to pass, and that again is a normal process in life, right? Because there's birth and there's death. That's inevitable. It's going to happen. We have to know how to move forward, and always remember that the person that we lost loved us for who we were when we were living, and what we loved about them while they were still living.
Right.
What we enjoyed the most is that we could laugh together,
Right.
and that we could be together and enjoy those things together. And so while we move forward and continue to live, because we are alive and we do have a responsibility in essence to continue to live and move forward, it's so important to keep their thoughts with us instead of feeling guilty, allowing it to saturate us, and know that they're with us and laughing with us, and their spirit is lifted because we are moving forward, which for some of us allows us to have more peace and give them peace in response to that. So we're alive. We have that responsibility to ourselves and to the family that we still have.
Right. And so, and if I could inject, and that's what happens with when you're experiencing those prolonged grief, because there's a part of you that feels the negative thoughts that, I wish I had died with that person. I can't go on. My life has no meaning, no purpose, and then guilt sets in when after you've worked through the grief and you kind of start wanting to, go out and rejoin society again. That guilt sets in. Should I be doing this? Because there's no length of time to the grieving process,
Yeah.
Yeah.
For sure. Teresa has a question. It's also difficult to deal with the sense of some relief after being a caregiver for many years. That also creates guilt. I guess that's more of a statement than a question, but so very true.
Yes, yes. You know, the whole time that you're doing caregiving, it consumes your life because it's no longer you. It's now you taking care of your loved one. And so much time is put into that, and you become so overwhelmed as you are caring for your loved one. At the end, when your loved one do pass away, there is a feeling of relief, you
Yes.
know, but then we feel guilty because it's like, why do I feel so relieved that my loved one is gone? You know, should I have these feelings? Should I be feeling these feelings? And then you start to feel guilty for that. But it is a sense of relief because you know now that you have done your job.
Right.
And, you know, so what I would say is that when you care for a loved one and you've been there through that loved one's journey, at the end of that, that's where you can gain a sense of peace, is that you know you were there to that journey.
Mhm.
Yeah. But it does set in guilt. It
Yeah.
does set in guilt that why should I feel relieved when my loved one should still be here?
Right.
And that's okay to feel that.
Mhm. And there's a lot of does this make me a bad person?
Yeah, it doesn't make you a bad person.
Yeah. And the answer to that is no. No.
Right. Right.
It is a normal process to feel relief for so many things.
Yes.
Relief of no longer having that burden, the release of just knowing that that person is no longer suffering, the
Mm-hmm.
release of being able to breathe, because we haven't been, as caregivers, being able to breathe for even a moment. We've always been on eggshells for such a long time, and we didn't know how else to be, and suddenly we have a little space and a little time, and it changes so many things inside of us. So yes, it's true that it is hard to not feel those things. Know that they are normal, and you are absolutely allowed to feel those feelings.
Yes. So true.
And oh my goodness, Rita also said, thank you for this presentation, because it really helps us to understand that a lot of what we're feeling is normal.
It's
And
normal.
yeah, and Teresa
Yes.
also says,
Mhm.
thank you so much. That is a great answer and very affirming. And they all wanted to let you know that you did a great job with this presentation. It was helpful, and they thank you very much.
Thank you. Thank everyone for being in attendance.
Yeah.
Mhm.
If there's no more questions, we just thank you so much for joining us. We hope that you'll join us next time, July 14th, for our next caregiving, Caring for the Caregiver presentation, which will be on healing and wellness for our caregivers. And again, it will be at 11 o'clock in the morning, and we look forward to seeing you guys. Thank you so much. Take care.